Welcome to this low back mobility exercise flow. We're going to start off the exercises with some simple lumbar tilts. We're going to place the head onto our hands onto the mat, try to flex and extend that low back so that you're tilting the pelvis, feeling a little bit of tension and then stretching through the low back muscles. From there we're going to move on to the classic yoga pose, child's pose, but in a repetitive sense. So we're going to rock back onto our knees, onto our heels, bending the knees. We're going to try and get a good bit of stretch through the low back. We're not looking to hold that stretch, we're looking to go into the position and move out of it to get some movement through the joints of the low back. We can then take that position and make it into a reaching motion where you're going around on a clock face, reaching over to one side, and as you do, you're going to just dip down to increase that stretch and movement through the low back on that side. And you're going to aim for around 8 repetitions either way. Once you've done that, you're going to come back up into a quadruped position, sinking the shoulder blades together as far as you can and moving the shoulder blades apart as far as you can. Hands underneath the shoulders, elbow locked at all times, creating a big stretch and then a sink. Notice the difference where there's tilting of the pelvis, both forwards and backwards. After that movement, we're then going to move on to some swivels. Again, similar motion to before, but this time we're moving side to side. So imagine bringing the rib cage and the pelvis together on one side and the same the other side. What you can do is also adding movement of the neck that you'll see here to match up with the pelvis, because we know the neck and the pelvis move in the same direction. Once you've done the swivels, then we're going to move on to back to child's pose. But instead of coming back to straight, we go all the way up and drop down into lumbar extension. Be mindful, this might be uncomfortable for some people, so just manage your own limits. If you can do it, we want to create the whole wave all the way as far as into extension as you can. Notice that my hands don't change position at all. It's just movement of the spine from full extension to full flexion. We can then focus in on just doing the lifts in that place. This is particularly helpful for patients who might have a history of disc issues in the low back. And so we want to just create some extension. Many people lack good extension in their lumbar spine. Then we can do some tail wags. Get the idea that our kind of legs are like our tail, wagging side to side, similar to what we did shortly before, but really trying to get movement of the hips involved this time as well. The next movement you can do are knee overs. So basically you're going to lift the leg up to 90 degrees, drop it off to one side and your head the opposite way. Slide the leg back down, lift up and repeat. It might feel a little bit tense in that kind of mid to lower back, and you may not find that you're able to take that leg all the way over. Just go to a comfortable position, and now you'll see it on the other side. I think I really struggle to get the full rotation on this side, so just go as far as you can and be mindful to move the neck in the opposite direction at the same time. We can then flip over and do the reverse of that movement. So this time the leg comes up and over, but into extension. And again, you slide that leg back down, right the way up and over to create some rotation in the spine, in the low back. This will be a movement that's probably unfamiliar to a lot of you, but will really help create some control and stability in that low back. Next movement then is more of a hip movement, but we know that this translates into really good low back motion. You lock your elbows and you're trying to get the knees to swivel side to side as far as they can all the way. So there's actually very little true spinal motion, it's more hip rotation that we're looking at here. Then to finish, we're going to look at pelvic and neck tilts. We have some other videos on this movement. What we're trying to do here is tilt the pelvis backwards and then forwards. And notice how the neck and the pelvis look like they're doing the same thing. So this is a really slow and controlled movement that you're going to gradually do for around a minute in total.